COVID Action Group presents Precautions to be followed in home isolation. This video is based on the guidelines given by the Ministry of Health and Family Welfare. Let us begin with the precautions to be followed by the patient. First, the patient must isolate himself to a secluded room and away from his family, especially from the elderly with comorbidities. The room should be well ventilated. Second, always use a triple layered mask and discard it after 8 hours of use or if it has become visibly wet and soiled. Masks should be disposed of only after disinfecting them with 1% sodium hypochlorite solution. Ensure cleaning of surfaces with sodium hypochlorite. Don't share personal items with anyone in the household. Stay hydrated and well rested throughout. Also, monitor temperature with a thermometer and blood oxygen levels with a pulse oximeter regularly. Disinfection and hand hygiene practices must be followed regularly. Now, let us see the precautions to be followed by the caregiver. Basic mask and hand hygiene should be maintained. Preferably, wear triple layered mask with N95. Never touch the front layer of the mask and immediately discard if it becomes wet with secretions. Avoid touching your own face, nose or mouth. Use soap and water for at least 40 seconds while washing hands. Avoid direct contact with the patient's sputum and saliva. Gloves should be used at all times while cleaning the patient's utensils, linen and items in his vicinity. Dispose of the waste effectively to prevent infection. If possible, keep one bathroom reserved for the patient. Otherwise, clean all the objects in the contact of the patient with 1% sodium hypochlorite after use. Please make sure that you follow these guidelines for the safety of the patient and your loved ones. Thank you for listening to this video. If you have any questions or requirements related to COVID-19 or even if you wish to volunteer with us, you can contact us at our website on the screen or on our Instagram page COVID Action Group.